Yeah, good evening, one and all. Welcome to Lighted Red Podcast Series, a joint initiative by NATCO and Voice of Healthcare Team. Audience, you all know Lighted Red is a podcast series platform which is dedicated to spreading awareness, sharing stories, and bringing hope to everyone who have been impacted with blood cancer and conditions like leukemia and lymphoma. You all know every year millions of people around the world are diagnosed with conditions, this blood-related blood cancers. So, yet too often signs and symptoms are ignored unnoticed. So today we have Dr. Ramesh Balasubramanian, a renowned hematologist and BMT physician from Velammal Hospital, Madurai, to understand and explore what actually the blood cancer means. And also he is with us till the end of the session to understand diagnosis, treatment in blood cancer, and also we explore newer therapies and also multidisciplinary care and clinical research in shaping the future of blood cancer therapy. It is always honor to welcome you, sir. Thanks for
Thank
your
you,
valuable
thank
time.
you. Thank you, Sundeep,
And
and thank you, NATCO, for the
it's been honored
opportunity.
to welcome you on this Lighted Red podcast platform, sir.
Thank you so much.
Okay. So without no delay, we'll start, sir. Okay. So when we talk about the basic kind of thing, what actually the blood cancer means, and how does it differ from other types of cancers?
So, blood cancer, actually, the term itself, to be frank, like it's very alarming to the patient. Like cancer per se is very alarming to any patient per se, and more dreaded of these all is what is blood cancer is. So we have a lot have been showcased in movies, and patients people have come across patients of blood cancer once like the news is broken to them, news is told to them, the life ends there, and the patient, their relatives, they die because of the disease. This is a myth which the patient or the relatives they get often. So the term blood cancer itself is like very alarming or threatening to the patient. Unlike any other solid malignancies, like malignancy per se, like any cancer itself is like very disturbing to hear. And amongst all cancers, the most threatened one is like what we hear is as blood cancer.
Okay. And when you talk about this types of blood cancers, how many types of blood cancers are there? And
Generally, if
can you
we,
please?
yeah, please. Then, if we see what the blood cancers are, they broadly we can classify it as like leukemias, lymphomas, and multiple myeloma. All these are belong to blood cancers. And among leukemias, you have either acute or chronic leukemias. Acute actually is generally is acute. The term acute itself means it's very sudden. It comes like a bolt from the blue. So it comes like very suddenly, and the patient may not have symptoms for like long together. It's just matter of few days, a few weeks, a few months. So that is what is acute leukemia is. And lymphoma is just generally presence as nodes, lymph nodes, swellings in your body. And multiple myeloma is the one which can affect your kidneys, bone, and so on. So these are the broader types of blood cancers.
Okay. And generally, who are at a risk, sir? Who are at risk developing this type of blood cancers?
Generally, these blood cancers, no, this can occur in any person. Like it can occur in any person for that matter. It doesn't restrict itself to the any particular age group or. But more vulnerable population is like we do see blood cancers in children and a very elderly population also. There are particular blood cancers which is prevalent in certain age groups, but irrespective of the age or the gender, so these blood cancers can occur in any population, starting from the childhood till elderly. And it doesn't mean it's like mostly familial. And if the common question which comes in the patient's relatives' mind is like, I have got, my brother has got or sister has got a blood cancer, or my mom or daughter or like mom or dad has got a blood cancer. Do I will I develop the blood cancer later on? So this is what the question arises. Mostly the hereditary cancers are not that common. Most of the blood cancers are acquired because of some mutations. So these do occur in all irrespective of the age group. It can occur in any patients for that matter.
Okay. Okay. any patients, irrespective of the age or all those criteria. Okay. And, to understand the burden, sir, there is an increasing incidence of blood cancer in India. How does you
Uh, Yeah,
elaborate?
actually, to say like the diagnostic part has improved a lot. So unlike the previously, like in the
Okay.
previous decades, the incidence of diagnosis has not been very clear, and nowadays the diagnosis has become the diagnostics have advanced a lot, and we do pick up a lot of blood cancers in the early stages. That is one thing contributing to the rise in the burden of blood cancers. And of course, the environmental factors or the urbanization may be contributing to it. The diet or urbanization may be contributing to it, but we cannot 100% attribute that to the rising incidence of blood cancer in the patients. So I would say it's mostly the diagnostic accuracy and the diagnostic part have improved a lot. So because of that, we are picking up a lot of blood cancers, say rather.
Okay. Okay. Sir, anyways, you are connecting to that dot, that diagnosis related term. So, what are the diagnostic or screening methods are there to detect blood cancer, sir?
So generally, leukemias, acute leukemias or sometimes the chronic leukemias, it can be picked up by a simple complete blood count itself. The complete hemogram itself can pick up a lot of blood cancers. Like you can pick up a chronic lymphocytic leukemia (CLL) or a chronic myeloid leukemia (CML) by just looking at your complete blood count picture. So that complete a CBC, that is a simple test, I would say. It's a complete blood count. So that can pick up a lot of blood cancers. Any chronic or acute leukemias can also be picked up by looking at the differential count of the WBC. How much are the neutrophils or the new lymphocytes, and it's like out of proportion. Then you'll have to do a peripheral smear examination to see all those are cancer cells or blast. You have to,
Mm.
it's a step-wise approach, I would say. Rather, like it does not depend on a single test alone.
Okay.
So it's obviously, of course, the first and foremost thing will be the clinical examination. You get to ask the history of the patient. Does the patient has any bruises or any gum bleeding or any nasal bleed, or the patient has got a prolonged fever, like I would say, like for more than 10 days or 15 days or so, or the patient does not feel like eating, feels like extreme tired, extreme fatigue the patient develops. So all those with the history of those background, and into the stepping into the clinical examination, you have the nodes, palpable nodes in the cervical or axilla or in the inguinal region, or then the your spleen or liver gets palpable. And then the next step, the first simple test I would say is the complete blood count, followed by a peripheral smear examination. Of course, the advancement in the diagnostic test like flow cytometry and the karyotyping, which determines the chromosomal mutations, and the genetic testing, I would say, which includes the next generation sequencing methods, which detects the mutations in the DNA and RNA. So a complete package of these lead to the diagnosis and, of course, the prognostication of the leukemia. So I would say leukemia, that like the risk, it will be a complete diagnosis, including the risk, what risk the patient falls into, so that it guides in the treatment of the patient.
Okay. So, during start of session, we have discussed about who is at risk. Now, coming to risk factors, sir, what kind of risk factors are there in blood cancer?
So risk factors are like I would say, as we have discussed earlier, like you cannot pinpoint a particular risk factor like smoking or alcohol or the having the junk foods, or because of the pollution, or you cannot particularly pinpoint one carcinogen to this one, to the increase in the
Okay.
occurrence of leukemias or lymphomas or myelomas as such. But it can be a medley of all this, or could the patient could have been genetically predisposed. On top of it, the patient has got a second mutation because of some environmental factors. It could be anything. You cannot generally just pinpoint this particular risk factor. If we could avoid, we could prevent a blood cancer, nothing like that.
Okay. Okay. Okay, sir. And coming to the any environmental exposure is also triggers blood cancer.
It's not like exactly some trigger. There could be anything. Like you cannot pinpoint, as I said, like you cannot pinpoint this to this. Like smoking is associated with lung cancer, and like eating, yeah, some taking junk food can provoke your colon cancers. Something like that can be there. Like, but for blood cancers, nothing. Related to your food is like not 100% association is not there.
Okay.
It could be just a trigger. The learning point
Even though
is like
environment. Okay.
it
Yes.
can occur in anyone. Like
Okay.
it can occur in anyone. That is the point I would stress here, because like I'm
Okay.
leading a healthy lifestyle, because why should I develop a blood cancer? This question can arise in any patient's mind. What common question which I get to
Okay.
hear from my patients is that I'm in a village, so I do farming. Like I'm in a tier 3 city, so most of my patients are from farming background. They're in some village. So I'm eating a healthy lifestyle. I'm leading a healthy lifestyle. I'm eating a homemade food. So, but I am doing farming. So there is no pollution in my village or town. So why do I develop? I am completely normal. I was completely normal like 10-15 days back. So it just started with a fever of like 1 week or 10 days or so. So with that history, the patient come with that background, patient come to the hospital for fever evaluation. Ultimately, land up as acute leukemia diagnosed. So this question commonly arises in the patients or their relatives. So I would say the answer is no. Like we do not know what could be the trigger, but if it is there, it is there,
Okay.
right? So it can occur in anyone.
Okay.
So you cannot ignore the fact that this is there. So early diagnosis, picking up of early diagnosis is very important, because you can avoid mortality in the patients. You can avoid death in the patients if you diagnose it earlier and start treatment earlier. That is the point I would stress, because acceptance is the one which delays the treatment also. So delaying the treatment leads to
Okay.
increased risk of infections and ultimately death.
Increase.
If blood cancer is suspected and it is diagnosed earlier, like instead of just waiting over to just think how did I develop that, like it's difficult. I would say yes, it is difficult to accept. But if that the diagnosis has been made, like you have to start the treatment earlier. So the thing is, like it's not like a
Okay.
particular risk factor is there. You have to accept the fact that if that cancer occurs, you have to start the treatment.
Okay. And sir, when we talk about signs and symptoms also, what kind of signs and symptoms the patient should be aware? Symptoms and generally, apart from fever,
Symptom
anything else?
Yeah, yeah. Fever is like a prolonged fever, like 10, 15 days duration, or sometimes they can have extreme fatigue. The patient would feel like I have not feel experienced this kind of
No.
weakness ever in my life. That is what they would say. Some a bone pain, very severe bone pain, especially in children. So you should not ignore the leg pain. Sometimes it is missed up as growing pain in the children, or it is sometimes just some rheumatological problems, some arthritis in the children, and they are being treated with steroids at some local hospital, and they present at a very later stage. So this is one thing I would stress here, because in children, any severe joint pain or leg pain along with fever, you definitely shouldn't ignore it. This could be a very important warning sign of blood cancer in children, especially. In adults, of course, it can be a prolonged fever and not taking food properly, and loss of appetite and loss of weight, and all these can be there in lymphomas. And severe bone pain, back pain can be there in elderly population, multiple myeloma, because they present with fractures. So any fracture which occurs without any trauma, without any injury, so that is of very concern. That is of concern, because that can occur in multiple myeloma, which is a type of blood cancer which affects the bone and leads to increased risk of fractures. Any unexplained increase in the creatinine levels. like sudden increase in creatinine levels, so and the patient is not passing urine properly, so that could also be one of the warning sign of multiple myeloma, because that can affect the kidneys. So and the patient can have some skin bleeding, or in the form of some bruises, reddish spots can be there, or gum bleeding can be there, or nose bleed. All those can be the warning signs. Yes.
Sir, when you talk about these children, two things are coming up: bone pain along with fever. You are saying this symptom, or how? What kind of bone pains? Two things. One is, can you please throw some light on this?
Yeah, bone
Because
pains.
children couldn't able to explain. So yeah.
Yeah, the bone pain will be like very severe. The child will not be like very active child who had been
Okay.
running around and running around, playing around cheerfully. Suddenly says like, I have very severe pain. I'm not able to move at all, and gets the child is bedridden, or child is lying down and not getting up. Also, the pain will be very severe pain. It will be of very like it mostly in the legs you can find it, or in the sternum you can find very severe pain, the ribs or the sternum, or
Okay.
mostly
So,
in the legs. The legs it can be there. So the child is not able to stand. So that such kind of severe bone pains can they're not exactly the knee joint pain, but it can be a bone
hmm.
pain. But it's not like
So he could.
the common thing can be like it can be a growing pain, like the child can because of the child get like as the child grows, the
Bone.
child can have
Yes.
pain that is a muscle related pain, it's not a bone pain. And
Hmm.
rheumatological pains mostly occur in joints, so it's not in the long
Okay.
bones as such. So the
Okay.
thing is like you should not miss it, like it must be a growing
Okay.
pain, or it must be some rheumatological problem. So always do a complete blood count and do a peripheral smell examination, and just rule out because these are very
Hmm.
simple tests. Doing a complete blood
Okay.
count and peripheral smell is these are simple tests available almost everywhere. So this could you could rule out a leukemia and then start the treatment for arthritis, or do some management for the growth pain. So those can be done, but the thing is like you should not miss out the early diagnosis of leukemia. This could be picked up by a simple test which is available everywhere, a complete blood count and a peripheral smell examination, of course.
Thanks for clarifying this doubt on children, sir, because a lot of children will cry because there is an initial growth development of bones. So I just wanted to clarify for our audience what kind of bones, sir. So
Okay.
the child itself couldn't able to stand. That is what you were saying. Severe bone
Yeah,
pain, right, sir?
very severe
Arthritic
bone pain.
joint.
Yeah, yeah,
Because generally children will cry actually if there is any pain. So that is what,
exactly.
just clarifying the doubt. Thank you, sir. And so coming to now, we have discussed a lot about risk factors and which type of and or what are the types, signs and symptoms, and also the diagnosis, screening. But when you talk about the treatment and innovation, sir, in last decade, if you take what was the treatment landscape, sir, and now after 10 years, how is the treatment landscape for blood cancer, sir? What is the development you have seen in your expertise, sir?
So, treatment actually comes through a lot of research, a lot of clinical trials. The treatment comes, and of course, the treatment in the hematology, the field of hematology and blood cancers has expanded a lot, expand a lot. As you could see, like in the past 2 decades, it has grown like in a tremendous way. Starting from initially, it was like chemotherapies, using chemotherapies and all. Now, like you have some many of targeted therapies, and you have immunotherapy and like checkpoint inhibitors, and the bone marrow transplant, now the CAR T cell therapy. So the blood treatment of blood cancer expanded so much. So there are different approaches for each and individual tumors based on the molecular risk stratification. Of course, the diagnosis blends into the treatment. So the diagnosis plays a major role, and the molecular techniques, and your so this field has got a lot of inputs from the genetics and molecular studies, and because of that, you get to understand the core disease biology, and you start treating the
Mhm.
patient accordingly based on the. So this field, unlike any other field, blends the molecular and the genetics into the it like it's this field actually is applies the medicine from the bench to the bedside, from the lab to the clinics. So what mutations is there? Like you apply it in the practice. So there are some mutations which is known to occur in certain particular populations of the some type particular types of leukemias or lymphomas, and the if you treat them with like the particular medicines, they do very well. So such kind of thing is there. So it is like chemotherapy and targeted therapy, immunotherapy, a combination of everything.
So it's based upon the molecular and identifying the mutations, right, sir? Genetics. Based upon
Yeah.
that, there is a personalized treatment for blood cancer, right, sir? Okay.
Yes.
And sir, can you throw some light on immunotherapy and also this bone marrow transplantation, sir?
So yeah, the immunotherapy is chemotherapy is generally nothing but the using the molecules which attack the rapidly developing cells. So that is of course the your tumor cells. It goes and destroys your tumor cells, as well as there be some damage on the normal cells also, and the normal cells recover later on. So targeted agents and immunotherapy, what it does is like targeted therapy is the one which goes and targets the specific molecule on the tumor cell, on the cancer cell. So that is the targeted therapy. Immunotherapy is you're using some agents like using some immune molecules which can be like from your body, like it's making your own immune system, your own immune cells to attack the cancer cells. That is what is immunotherapy. There are some in which also there are, it varies a lot. There can be monoclonal antibodies. Monoclonal antibodies the goes and particularly targets some molecule on the cancer cells, or it includes some checkpoint inhibitors, which makes which makes your immune cell, your the patient's own immune cell attack the tumor cell. So all these are the novel immune therapies, and bispecific cells engagers are there, which which molecule actually binds. It has got two arms. One arm binds to the cancer cell, other arm binds to the patient's immune cells. So it forms like a bridge between those and
Okay.
makes the patient's own immune cell attack the cancer cells. So all these are very fascinating. Of course, it's not only in the research part. It's of course used in the patients. It is available in the treatment of blood cancer, and the cure rates are very good with this new novel molecules. And bone marrow transplant is broadly we could say it could be autologous or allogenic. Autologous is taking the patient's own stem cells and using high dose chemotherapy to destroy the marrow, and then reinfusing the same stem cells which are taken from the patients to them. Allogenic includes a donor, which who could be a full
Okay.
matched sibling, full matched brother or sister, or could be or a full matched non-sibling donor from the registry, or it could be a half match haploidentical donor. So using those stem cells from them and infusing it to the patients after giving some radiation or chemotherapy to the patient. So that is what is allogenic bone marrow transplant, which is of treatment in high dose in high risk acute leukemias, high risk ALLs and high risk AMLs. And autologous is generally given autologous transplant is for multiple myeloma and for relapsed lymphomas.
Okay, sir. Okay. Okay. Okay, sir. So many therapies are available so that personalized treatment is there in blood cancer. So it's very easy to decide, right, sir? Hello.
Yeah. The personalized treatment is available, so it's a kind of tailored treatment,
Okay.
taking into account the patient's age and the what the comorbidities. The patient has got diabetes, hypertension, and what risk the patient has got, and taking into what infection the patient is having. So taking into consideration of all of this, so the treatment could be tailored. Could give immunotherapy or chemotherapy, a targeted molecule, or a combination of which.
And sir, you know, when we talk about Indian perspective, one of the biggest challenges affordability. So how far these therapies are affordable and accessible to the patients, sir? Like targeted or immunotherapy or BMT. So.
So it's a very good question. So affordability, of course, definitely it is. It's a very challenging part. So as per data, you could see like in AML, I would say this is a very dreaded blood cancer among all. AML, there is a landmark paper which highlights with the real world data, which shows like only very less than one third of the patients that get treated. Like out of the like 100 patients, I would say like only 30% they go and get the treatment for it. So this was the pathetic state, and because it is going to cost very much, and with the advent of newer molecules and the generic molecules, so this has changed. So because the off-target effects are low and the side effects are going to be slightly lesser, so this has slightly reduced the expenses also, I would say. So there are certain molecules. Initially, the cost was higher, but later on, after generic medicines have come up, the cost has significantly reduced. And certain blood cancers like CML, CLL, it's like a kind of OPD based treatment. There is no requirement for admission. When even I don't admit patients of multiple myeloma also. So I just give outpatient based treatment. So like that way, like the cost is significantly cut down. So like certain leukemias, of course, they do require admission, and with the availability of immunotherapy or targeted molecules, so you could bring down the cost of treatment. But certain, of course, yes, the certain immunotherapies are still very costlier. They're way costlier for many patients to afford. So I'd say, so as we have discussed earlier, so it's very pathetic or very sad to say that like anyone can develop a blood cancer at any point of time. So not necessarily blood cancer. Anyone can develop any illness. So it's better we have a very good health insurance policy, and of course there are government schemes are there, and the government scheme, the PM's scheme, and the state scheme, they support the patients bone marrow transplant. They have a very good coverage for bone marrow transplant in helping the patients out. And Sandeep, are you there? Sandeep? And so treatment, of course, so the government schemes are there, and apart from the government schemes, the formation of some trust, the cancer funds and the trust, of course, helps a lot. And in the treatment of childhood cancers, there are many support programs are still there, and they could be utilized in the treatment of the children with blood cancers.
Sir, sorry, sir. My system got hacked, sir. Hello.
Oh, no problem. Yeah, no problem, no problem, Sandeep.
Sir, sorry for the inconvenience. System got hacked. My system got hacked. Sorry very much.
Yeah,
So we
no
were
issues.
talking about the accessibility and affordability, sir.
Yeah.
So connecting to that accessibility and affordability, sir. So as per you, what are the biggest barriers for the quality blood cancer care in India, sir? Schemes or anything, as per your advice or suggestion? Biggest barriers for
So,
quality cancer care.
the biggest barrier, if I would say, first is a myth. There are many myths around blood cancers. So we have to eliminate all those myths. And of course, treatment of blood cancers require a lot of patients, I would say. Blood cancer, the treatment of blood cancers, like especially leukemias, they test the patients of the patient and their relatives, and of course the doctors also. So like in the initial phase of treatment, like when you say the you have to do a test, and of course the third point will be the affordability. So when the diagnostic parts, as I mentioned, like which includes a peripheral smear, flow cytometry, genetic testing, molecular testing, although the testings are going to cost around, like I would say, like close to 40-50,000. And so when you break that news, like for doing a test, it is going to cost, for doing a test itself is going to cost around 40-50,000. And how much will the treatment cost? So that question occurs naturally. It can occur in any patient or any relative for that matter. So
Yes.
at the first go, you're charging around like 40-50,000. So for just for the diagnosis, so for the treatment, how much it is going to charge? It's definitely going to charge a lot. That is what many think, and they don't take the treatment, just leave. And that is the first barrier which I'm facing in day-to-day practice. And second is like the patients are relatives or their well-wishers, or they're known to, they have their own perception and their own opinions. They mostly they end up confusing the patients or the relatives, I would say. So blood cancers are incurable, and ultimately they'll be living for like few months. So are you going to spend a lot on them, or you're spending so much on them? So this kind of questions do arise. This kind of problems and situations do arise in day-to-day practice, and this is a very big challenge. So you'll have to sit with the patient, spend more time with the attenders, relatives. You have to explain them. So this is not this. This is a very curable cancers. Like, but there are a lot of blood cancers which are which have a very good cure rate. You have to sit and explain them. You have to be very patient. You have to explain all the queries to them. It's not like you make the diagnosis, you say you do we'll give this chemo, that chemo, that this. You should not confuse them. You have to sit with them. You should explain them in a stepwise manner. And you should be lending a supportive hand to them, because like it's like as I said earlier, it's also like bolt from the blue. It is very difficult for anyone to accept, 10
Wow.
15 days of fever in a healthy, hale and healthy person, like, and who will accept it? No one will be ready to accept it, right? So you have to sit with them, spend time with them. And you could see me, like I explain to all the relatives who do come. The new attenders, they do come, like they
Yes.
keep on coming for a very few days. I patiently explain to all of them. Daily new attenders, you would see, like daily new attenders jumping in, and they would ask the same questions. So yes, of course, that is our responsibility, that is our duty, because I'd say like it is a difficult thing to accept for any patient or any relatives of the matter. So during the initial diagnostic part, this is the most important challenge, I would say. So lending an emotional support to them is also very important. The most important thing we forget in practice is giving the emotional support and the psychological support. So those should be given to them. So those are very important. No, it's not just the chemotherapy or giving the blood transfusion or the platelet transfusion. It's not going to end with that. To spend time with them, give emotional support. You make them you make the patient smile. So you make the child smile. So you become friends with them. Like it's a lot more, because it's like a travel. They have a journey with us. They travel with us. So you have to spend time with them. And treating blood cancers is like more of empathy along with the chemotherapy, I would say. Chemotherapy, immunotherapy, and so much we talk, and we don't concentrate more on the empathy part, or we don't spend much time on asking their perception and what do they feel, and do we address it. So all those things matter a lot. So these two things I would say. And of course the most important of all is the treatment challenge is the cost. Cost of course is a cost
Yes.
constraint are still there, but we could tackle it in a few ways. Like OPD based treatment can be employed in certain type of blood cancers, and you can have some certain companies are giving some medications, they do have a patient assistance program, and that helps a lot for many patients. like um that helps. And it's like the hospital also supports the treatment of some patients. And I'm currently in a medical college hospital. So we here the room rent is waived off. The patient is admitted under medical college, there is no room rent, they don't charge for the they don't have the bed charge, and the for the food and all. And that is the patient is admitted in the medical college side. And so by that way her hospital also supports. So and of course a patient assistance program from the companies, and some trusts, some cancer funds are there. And from the government side they do have funds for bone marrow transplant, and they do support the bone marrow transplant program. So all this all there.
Thank you very much, sir. I was about to ask the psychosocial impact. You have touched upon the psychosocial impact also, and also the care given or caregivers play role play also. You have touched each and everything you have touched, sir. Because I was about to ask what is the psychosocial impact. Because in movies we already touched on this. In movies they show hero or heroine get blood vomitings and it's so dramatic. But in real life it's not so dramatic. It's very simple, sir. You by the way you have touched upon the things, it's very simple. Means the blood cancer is curable and manageable, right, sir? Can I?
Exactly.
Hello,
Exactly. Like many blood
and
cancers,
sir,
yeah.
exa-
Please, Sandeep.
please continue, sir.
Yeah, many blood
Please
cancers are
continue, sir.
curable, and many blood cancers are curable, and these are managed. Like I would not use manageable also. It's like many blood cancers are curable, and like the proper
Curable.
you have to take into account what the patient's age group is, and what is the what all the patient's comorbidities like diabetes, hypertension, what all is there, and what is the age of the patient. So like for example I would say like an 80-85-year-old patient is having a very severe uncontrolled diabetes or hypertension. I would not jump in and the patient has got a very high risk multiple very high risk acute leukemia or AML. I would not jump in and enthusiastically give some immunotherapy or chemotherapy. So you have to tailor the treatment accordingly. And what are the patient's aim? You have to sit with them and discuss. So and the patient's relatives, what their aim is. Quality of life is what needed for such patients. Quality of life is living a pain-free life, living a pain-free life, and the patient. The pain has to be addressed in that population, and the patient should live happily till how long they are going to live. Whereas like the patient has got a very good risk disease, is even an elderly like 80-85 with comorbidities like CML or CLL. It's just simple. In that case you don't choose a palliation. You can treat them, you can treat them, you can bring the disease under
Yes.
control, you can even cure them also. So, like, what the disease the patient has got, and what is the age, and you know what how the patient is going to perform with the disease. So, with that, you explain, like it should be like very clear, crystal clear. Explanation has to be. It's like it's not like it's like a mutual decision making. You have to sit with the attenders. You have to explain the pros and cons, and you like the risk of infections, risk of mortality, risk of death. You have to discuss with them. If you're giving going to give an aggressive therapy, or if I give the supportive treatment, how long will the patient survive? So all those factors are important. So mutual decision making, I would say.
Okay. So, okay, sir. Thanks highlighting each and everything, sir. But last but not the least, sir, one strong, powerful message for the audience from your side, sir, because you have explained so patiently and you elaborated each and everything very clearly, and you make the I mean to say very understandable, sir. So, in that way only, please give a strong and powerful message for our audience who are
So I
watching
would say like not one, I have three. So first is like
in this
don't
live
believe in the dramatic movie contents about blood cancer. The diagnosis is made, the die of blood vomiting and all. No, it's never like that. So there are
yes, sir.
no, so many types of blood cancers which are very much curable. So if the diagnosis of blood cancer is made, it's not an end of life. So your life starts, your new life, I would say, starts with the diagnosis of blood cancer, and which includes a social impact, and psychosocial support is important. So family members support is very important. So second is, I'd say, whenever you do a blood count, no, don't just do a hemoglobin alone. So it's in the wrong practice being done at many places. They do check a complete blood, like they don't check a complete blood count. They just do check just a hemoglobin. The patient is feeling tired, extremely tired. They do just do a hemoglobin and see your HB is 4, your HB is 5. So give 2 units of blood transfusion, iron injections, B12 injections, and the patient is sent off home. Patient is treated in the clinic for like around 1 week or 10 days, giving just IV iron, loading them with B12 injections, giving blood transfusion. The patient ends up very late in advanced stage with numerous infections, and which becomes very difficult to treat, right? So a simple complete blood count, including the differential count. So not just the
Okay.
hemoglobin, it includes the WBC count and the differential, which includes the neutrophils, lymphocyte percentage, and
Different.
all those along with the platelet count. So which can diagnose some blood cancers at a very early stage. So I would say doing a complete blood count, including the differential count. This is the second point I would stress. Third is, first is which is many blood cancers are curable. Second is like complete blood count,
Okay.
including the total differential count. And third is, uh, so don't just ignore any symptoms. It's like you have got some bruises, I've got prolonged fever, and got some bone pain in children, and don't just ignore all those, especially the bone pain in children. So don't ignore it as some arthritis or growing pain. Bring to this concerned specialized doctors. So if the pain is persistent, and don't just treat your child with steroids without ruling out blood cancers. If the child has got a prolonged joint pain or leg pain.
Okay. Joint. So these three things, sir, definitely our audience will remember on that. Thanks for your valuable time, sir. Uh, you have touched upon each and every aspect and also clarified the doubts the audience who are listening and also the patients who are listening on this platform. Thanks very much, sir. Uh, in upcoming, we do a lot of awarenesses because a lack of awareness also may affect the this blood cancer treatment, or because a lot of people are, as you said, symptoms have been ignored. So with these three kind of messages, thank you very much, sir, for giving your valuable aspects and all, as well as your expert opinion in each and every terminology of blood cancers. Thank you very much, sir.
Thank you, Sandeep. Thank you, Natco, for the
Thank you, sir.
opportunity. Thank you. Thank you.
I will send you the link, sir. You can